I decided to talk on understanding hyperpigmentation. So pigmentation is a very big problem. Like everybody's like always worried about their face, and everybody has this idea that the face has to be what I call it, flawless. So if you're not sure what I'm talking about, basically pigmentation is those spots on your face that you do not like. That's what pigmentation is. So hyperpigmentation normally occurs when your skin starts to produce too much pigmentation on the skin, and it makes it darker than the surrounding skin. So if you have it in one spot and it's a lot, you call it a mole. But if you have it in certain parts of your face and you kind of like see patches here and there, then you feel like your skin tone is not even, or you see a patch on your cheek and say, oh, this is pigmentation. Common term, right? Or in Malay we call it different words like jeragat and things like that, which actually is the same thing. So it's usually related to UV sun exposure and other factors that includes your genetic makeup. So there are some people who are so lucky that they're born with really good genes. They do not really get pigmentation problem until maybe much later. The other thing is also your hormonal imbalances. We know very well that, you know, for women, we go through different phases in our life. We go from our teen explosion all the way to fertility mood, to pregnancies, post-pregnancies, then we go to perimenopausal, then postmenopausal. So all the time that we have hormonal imbalances, it actually can cause worsening pigmentation to your skin. Skin irritation is quite common, and other problems, use of certain chemicals or products on the face. But why does it bother so much? So the main thing about pigmentation is that, you know, it's just like that ant sitting on my slide. Whoever has seen that ant, some people are like, why is there an ant there? Some people are like, they don't really care about it. It's all about perception. It's how you look at yourself and how people look at you too, and how you think that people look at you. So in certain cultures, things like freckles, they're considered very beautiful. It is a form of pigmentation. But in other parts of the world, they regard it as, oh, you have dirty skin because there are a lot of spots on it. Like us being in Asian culture, since a very, very long time ago, since the Chinese dynasties, we are always obsessed with this flawless, fair, pale-looking skin that doesn't have a single spot. So when you have a single spot or pigmentation, it really bothers. Okay, the different type of pigmentation, you have the development. Luckily for us nowadays, okay. Luckily, we actually have lasers that can remove tattoos nowadays. So that old boyfriend that you got drunk somewhere in some bar like 10 years ago and you start putting matching tattoos on your thigh, yeah, fine, it's all right. You can actually get rid of it nowadays. So it's not really an issue, except for it's the color of the tattoo, because different lasers have different wavelengths. And for tattoo removal is also another big topic. So we're not really going to talk about it today. So what are we going to talk about today? Okay, the most common among a lot of women, melasma. So what is melasma? Basically, it's that, you know, patches of brownish, reddish, blackish on your face, which occurs because of changes in your hormones and also the sun exposure. So this is the typical normal thing that you normally get, and it's very common in women because we have our hormonals up and down. But it's also, very, very distressing, because you see it and then you try to conceal it. So initially you think, oh, it's just an indifference in the tone of my skin. But then you find that as it progresses, it gets darker and darker, and then you have to find a concealer to conceal it with your foundation, and then it's going to be like, oh my God, what else can I do? Or you just go and say, I don't care about it anymore. We also sometimes regard this as age spots, because as you age, it's more, duh, because longer exposure to the sun. Okay, so why does melasma occur? So like I mentioned just now, you have a direct exposure to the sun. And we are blessed in a country that has 13 hours of sunlight, but we're also blessed because we're actually in the equator. So technically the sun that we get is actually good sun. And the UV rays are usually worse in the mornings. Yes, people in the mornings, not in the noon, but early morning, because they're slanted rays. So you have more UVA, UVB coming through. And this is one of the most, how to say, the biggest factor, which is direct exposure to the sun. Okay, so this is why you see melasma in your cheeks, your forehead, because that's where the sun hits your face. The rest depends. If you're like me, like really high cheekbones, you don't see much in the lower bit, you see more on the upper bit. Pregnancy and hormonal changes that I mentioned just now, we do get melasma, or we actually in pregnancy we call them cloasma, which is, we call it the mask of pregnancy. And some people realize that they get it normally during the second, going to the third trimester, and sometimes after delivery it kind of like lightens, but it doesn't really go off. And then as you age, it becomes darker and darker. Okay. There are also certain medication, drugs, supplements, chemicals, and even essential oils that can actually cause worsening pigmentation. You know, some people, they keep thinking that, oh, if I take supplements are not dangerous, but actually it's not true, because at the end of the day, everything's based on your dosing. If you take too much of something, you may have problems. Essential oil, actually the ones that's really well known, if people who play with aromatherapy like I do, bergamot is one of those that you cannot use on your skin and get exposed to sun, because it causes pigmentation. Okay, so and the last one is also the underlying medical conditions that you may have. Like the most common is actually hypothyroidism, when it means that your thyroid levels are very, very low, and they find that people with lower thyroid levels tend to have more pigmentation. It's something to do with the mechanism of pigmentation, where you have this thyroxinase inhibit the phase, and in hypothyroidism there is also some issue related to this. Okay, so this is example of melasma. This is like melasma that's mixed, where you have dermal and epidermal. You have both deep and non-deep melasma. You have some redness. You have like how say pinkish look, but it's still, what's going to happen to this pinkish look, it will turn dark eventually. So sometimes I have patients who come to me and they say, doctor, I have to get rid of this, it's pink here, and I know it's going to turn dark. It's actually this earlier signs of melasma. So what we do is we give treatment and we get rid of it. But unfortunately, because of the consistent exposure to UV light and the sunlight, and with age and hormone imbalance, it tends to come up a bit more and more. These are other melasma spots. Sorry. And sometimes you see them as these spots instead, and and sometimes you see it as a whole patch on your face. So I remember when I was very young in this aesthetic industry, like maybe close to 10, 11 years ago, I used to have a patient who had really, really bad melasma. And the problem was, it was the whole side of her cheek. And she did IPL, but instead of making it better, it made it bigger and worse. And so I had to do a combination of multiple techniques in order to get rid of it. And now she's much, much better and happier. And now with the better lasers that we have, it's almost completely gone. this is another form of melasma. So even if it's on your forehead, you know, it is melasma. It's not just here. It's not just the side eye, but you can have it here. You can have it here. Anywhere the sun actually kisses your face and where your melanin actually starts to produce more pigmentation, that's where you're going to get the melasma. Okay? So let's take a breather. Really long. Okay. So that's basically about melasma. Just a simple overview. I try not to put too many let's say scientific diagrams because I know we're talking to patients, but it actually involves how to say it's quite a long process inside where the sun hits the skin and then it kind of like warms up and then it hits your melanin cells inside the basal epidermis, and then it starts to form more and more pigmentation. Okay. Okay. That's done. Let's go on to the next one. Okay, let's talk about post-inflammatory hyperpigmentation. So post-inflammatory hyperpigmentation, or I also call it PIH. Now the problem is when you talk about PIH in the medical field, first thing that comes to mind is pregnancy-induced hypertension. So the term PIH is not that familiar to talk about pigmentation. But if you've been to if you talk to a skin specialist or aesthetics, we understand what PIH is. Okay, so what it is it's post-inflammatory melanosis. What it means is that it is a reactive. It is how the skin becomes more reactive to any form of injury to the skin, and it just produces more and more and more and more melanin. And the thing is, PIH is actually more common in us Asian skin, especially skin type 4 or 5, because we're a type of skin that we're not really fair, but we're not really dark. So we actually have enough pigment to make it really dark. But PIH is something that doesn't affect everybody. Some people are so blessed they do not have this problem. And I'm like, well, you are so lucky. So how do you know whether you have this post-inflammatory hyperpigmentation problem? It's quite simple. When you have any acne, do you get any marks afterwards? If you get those dark marks, definitely you have this post-inflammatory hyperpigmentation problem. So why is it important to know whether you have this problem or not? It also affects how you react to certain treatments. Like for example, like me, I am extremely PIH prone. Like, see, I felt this has been there since last year. I fell in the clinic, it's almost a year and it's still there. And even on my face, I tend to have acne spots. And I'm like, geez, I'm turning 40. So, but I've always had this problem. So growing up, it was so stressful. It's the common cause of PIH is actually acne, like I mentioned, like if you have all those pimples coming out, and even those pimples small, but what's more frustrating is the pigment that it leaves behind. And then some people with eczema, okay, this is quite sad because they get like eczema all over the skin, and then it turns dark after it goes away. And also burn injuries. So in burn injuries, it's quite bad because, sometimes depends on the degree of the burn. Like you can have a 1st degree, 2nd degree, 3rd degree, and for people who have prone to hyperpigmentation, after it heals, it turns all dark. So it's a frustrating problem. It's hard to treat, requires multiple modalities. In fact, some people think that, it's something you just have to live with. But fortunately, nowadays, we have ways to treat this problem. For those who are Chinese, a little bit easy perhaps because most of you, I do meet Chinese with PIH problem, not that many, but most of you do not really have this problem. Like I said, it's really a matter of your genes and your the number of melanin inside your body, and also the melanocytes. Okay, this is an example of, it's not that clear because I took this from the internet, but basically when fairer people, it looks reddish. and maybe have brown spots. So in a way, not too bad, right? If a bit of concealer, a bit of green color, it's all gone, right? But if you're a darker person and you have more melanin produced by your melanocytes, you can have something this bad where it looks like purplish pigmentation, and this is all PIH. Or you can even have it on your back, like you have some breakouts on your back, and this occurs, and then there goes that lovely bikini for the summer because you can't wear it because your back looks horrible. And this is very distressing. Like I told you, normally you see this more in darker skin, like Indians and Malays, compared to Chinese and Caucasians. So it is a problem, and it's quite a sad problem. And I do have patients like this who come and say, "Doc, I'm getting married. I mean, my back is so horrible. I don't want and normally they get this. It's not really from anything, but rather waxing the whole back. Yes, even waxing can cause post-inflammatory hyperpigmentation. So even for those people who wax, if you have a tendency to turn dark after any form of inflammation, you have to be careful, because if you wax, then you're going to darken it. So you have to find solutions to your problems, okay? Which it can be different. This is post-inflammatory hyperpigmentation post-laser. So even though you say laser is something that you can use to treat pigmentation, you have to also be careful, because it can also cause burns, and after the burn, like I said just now, burns, you can even get a pigmentation problem. You can have it darken. Actually, this is my face like close to a year ago. And what happened was we were fooling around with lasers, forgot to cool it down properly, and voila, you get PIH. It looks so horrible. It lasted there for more than 6 months. Quite happy my face now. It's not too bad. I still have remnants of it, but at least it didn't look like that, and at least I don't have to walk around like that. But it took more than 6 months. So how to treat the problem? I actually prefer to have a more interactive, so that I don't have to talk alone. But come on, any ideas, people? How do you treat pigmentation? I would like to hear what the audience have to say. Like, anyone? No? Yes? Actually, it's all there, but then if you don't want to, wear sunscreen. Oh, Ivy, yes. You can wear sunscreen, but if you already have the problem, it's not going to help, because sunscreen is not going to remove the pigmentation. Okay, laser. Yeah, we can use laser. Anyone else? Any ideas? Well, talking about laser, whitening creams. Okay, yes, we can use whitening creams. Yep, very good. IV, hydroquinone, keratolic product, vitamin C. Yes and no, but yes, you can. Yeah, it's so funny about vitamin C. Like, everybody's thinking about, oh, if I want to be fair, I can take vitamin C injections. But there was a study done in the year 2010. It was published in Medscape. And it was about, they compared like modalities of 3 different types of vitamin C. One is a topical one. The other one is, topical is 20% vitamin C serum. Oral is about 1,000 grams of vitamin C oral tablets. And IV vitamin C given 2 grams. So among the 3 modalities given, they actually found that topical vitamin C 20% gave a better improvement in skin whitening than the other 2 methods. So yeah. Okay, anyone else want to give any suggestions? Yes, no, no? Okay, let's move on then. Yeah, that's very good, people. You have laser, whitening creams, vitamin C. Keratolytic product, yeah. If people who do not know what keratolytic products are, it's basically all your exfoliators, things that can exfoliate the skin. Now, the rationale is that when you have a pigmentation in the basal ganglia area, epidermal area, by using a keratolytic agent, it actually helps to slowly remove the dead skin, and thus stimulating the basal epidermis cells to actually produce more skin, and it pushes up the pigmentation and it becomes more superficial and it goes off. So basically that's what's the function of a keratolytic product. So treatment options, yes, you can have energy-based treatment, you can use laser, IPL, LED light. There are studies that show that even using these things, it does help. However, nowadays the consensus is that depends on the type of pigmentation that you have. So if you have light pigmentation or superficial ones, which is sitting in your epidermal layer of your skin, things like IPL, LED light, chemical peels, or even topical skincare, it actually can help. But if it's deeper, you definitely need laser. And then the next question would be, what type of laser would you like to use for your skin? So the standard is basically to use either a pico or a Q switch. And why is because these are the two waves that are able to deliver enough energy to break the pigments without inducing more pigment because of the heat. So some people say like, oh, I can use a CO2. Yes, you can treat pigmentation with CO2 laser, but you have a risk of causing more pigmentation. Now, a very interesting observation that they did using laser to treat melasma, and I remember this when I went for IMCAS in, let's see, I think IMCAS was in Bangkok, year 2016, 15. Oh, sorry, it was 2014, and they had this nice overview of melasma after 10 years. So what they did was they compared nobes. Sorry, it was 2018. Yes, 2018, sorry. Because I remember when I was in 2008, it was the first time I attended any of the courses. So what they did observe is that even though you have the best laser, be it a pico laser, say you have a pico laser, which is the most latest in the market, the problem is, even if we remove your pigmentation, if you do not use any sunblock or use any post-care or anything, just left it, the recurrence rate for any laser pigmentation treatment is about 3 weeks. That is the average. So you can't just say, oh, I got pigmentation, I go doctor, I go shoot it, go bye-bye. No, there's no such thing. You know, when you talk about treating a treatment option, it's something that both sides have to be committed. The doctor's going to be committed to get rid of your problem, but you also have to be committed on your side that you will follow the post-care, because without the post-care, there's no point. Okay, that's number one. Number two, which one is better, a Q switch or a pico laser? The difference between a pico laser and a Q switch laser is really the energy that is used to shoot. So what it means is that why we use picosecond is because it's really fast, that it actually is able to deliver a higher energy to the same depth with less heat. Whereas when you talk about Q switch is like a feathering method where you kind of like, you shoot this way. So you only hit like one spot. And that's why sometimes you find that when you do a Q switch, you need 5 to 10 sessions. Whereas when you use pico, you maybe need about 3 to 5 sessions. At the end of the day, the laser is a laser. The one using the laser should have sense how to use the laser, because, you know, a lot of clinics now, they're invested by business people. But the problem is the expertise of who's the one holding the laser? Like, how old is the doctor? How much experience? Oh, okay. My voice is faint. Yeah, I'm losing my voice. Okay, can you hear me now? Okay. So, okay, cool. Sorry about that. Just let me know if the voice doesn't come out, because I'm using a screen and the mic is at the monitor. So when the mic is at the monitor, sometimes when I lean back a bit, the voice does not project in front. Okay, so back to the lasers just now, like as I was saying, you can have, a clinic can have the most high-end device, but if the doctor is not well trained or just a few light years or maybe a few months old, you're not going to get a good treatment. So then people will ask me again, like, hey, why do I need to go to a aesthetic clinic when I have all these beauty salons that offer, pigmentation treatment, we use the latest lasers. Like there are a few outlets that open and they ask you to sign up packages and do it. So, okay, what is the main difference? When you go to a salon and get your laser done, what they do is they just have a setting which is very standard and they just do it. So it's just like you getting a wax job done. That's it. They're not going to treat your problem. So if your face doesn't really have a problem, yeah, it would be good for you perhaps, or it may work, perhaps. But there are a few things that you have to consider. One, if you really have a problem, like for example, like skin like mine, I have a tendency to get darker if it's too much insult. They might make my skin worse. Okay, that's number one. Number two, the duration and the amount of treatment that you are doing, sometimes when it's not coupled with the right post-care, what happens is you will get rebound pigmentation. Okay, so these are a few of the things. So since people are not asking, okay, you can ask questions later and just collect questions. I'm just talking random. So IPL and LED light. IPL is totally contraindicated for melasma because it may worsen it. Although some people swear by God, yay, it does work. I personally, I had the opportunity to use a Rolls-Royce IPL, literally, and I can treat melasma and PIH with IPL, but you have to be very, very, very careful because it can also cause it. Okay, LED light. If you look online and everybody says, use LED light, can get rid of your pigmentation, yada, 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 yada. Okay, first of all, LED light, you need the right, you need the right wavelength. So you need a 633 nanometer LED light, which is actually a red light to help with pigmentation, yes. But how does it really help with pigmentation? It's actually more of skin rejuvenation on a whole. So some people say, yeah, but it's just LED light. Can I just buy light and just use it on my face? You can try, but the thing is, sometimes the real problem is the intensity of the light, the dose of the light that you're getting. Sometimes when you buy off machines, which God knows of, like you can get it off Alibaba or even now even Lazada, you have no idea how much energy is really sent to you. Like how much energy are you really getting, number one. Number two, is it really LED light? Number three, is it really the right wavelength? How do you know? How do you check? So you may not know. And this is why I really make it a point that we should really invest in quality machines, because at least you have the specifications and everything. So these are a few things to consider. Now we talk about chemical peels. Actually, I love peels. Peels to me are one of the things that I really like doing. To me, it's like a deep cleansing for my skin, especially when on and off you have makeup. But there are two types of peels. You have a light peel and you have a medium peel. And I have two types of patients. I have one patient who type that, doctor, I cannot have any downtime. I just want to look good. I don't want to have, peeling off my face. So these patients normally use light peels. Personally, for me, I prefer light peels because there's no downtime. And you know that you're stripping off only the keratin layer in the skin, and there's not much injury to the skin. However, if you have deeper pigmentation, you may need a medium peel, which is something like a TCA peel or a retinol peel or something even more of a combination peel. Now, in Malaysia, we are not allowed to use phenol peels, although for those people who are who have traveled or from overseas or you know, there is such thing as a phenol peel, which is a deep peel, but the downtime is really bad. So it gets rid of every single thing. I think nowadays more and more people are moving away from it because it does have other complications. Okay, other treatment, mesotherapy. If you're not familiar with the term, mesotherapy just means small doses given, small injection doses into the skin. This is mesotherapy. So pDRNA, for those who are not sure what that stands for, it stands for polydeoxyribonucleic acid, which is actually salmon sperm derived, which in other words are those brands like Regerin and what's the other brand? Yeah, you have Regerin is the most well-known brand for pDRNA. You have Placentex, and you have the other one, I think it's Bella Vita, and then Filoga. So there are many, many brands. But what it is really using the salmon sperm, they extracted the RNAs, and they found that when you inject into the skin, it actually helps to rejuvenate by giving more polypeptides and RNA material to your skin. So it kind of like fixes it. And then when it fixes it, it also gives a lightening effect, perhaps because it actually stops inflammation, thus there's less, I would say, pigmentation going on. So personally for me, I love pDRNAs. I love using the salmon sperm thing, although sometimes my guy friends are like, salmon sperm, what about guy sperm? Does it work the same? I'm gonna leave it at that. Okay. Yeah. So when I have problematic patients in terms of trying to get them to heal, but at the same time, I need to do it fast. So normally I use a combination treatment. So one thing I have realized is that when I inject pDRNA under the eyes, I find that when you have pigmentation under the eyes, it kind of like lightens up almost instantly. But the trick is you have to know where to inject, which layer of the skin to actually inject. So you can't just have any Tom, Dick, and Harry and say, oh, let me do it, and you will not get the result. pDRNA, as the other one I forgot to put in is actually PRP. These two things you have to inject at the layer that you want it to actually take an effect. So if you were to do PRP or pDRNA with deep injections, you may not see much because it is not the area that you want it. When you talk about pigmentation, most of it is either in the basal epidermal layer or it's in the dermis. So the injections have to be quite superficial into the skin. Okay. Topical skincare. Yes, somebody. Oh. There's a question. Masa umur berapa pigmentation akan mula nampak? Okay. When you talk about pigmentation, what age do you normally see it? Like I mentioned just now, it depends on your genes really and your exposure to sun. You have two twins. They did a study. They have two twins, and they put one in the sun a lot, and the other one stays indoors. And when you compare after 2 weeks, the one that's out in sun had more pigmentation than the other one. So that's one. Number two is age-wise, usually you can see pigmentation as young as even in your early 20s. You can even have, if you're talking about melasma, it depends on how fast you get pregnant, because some people in early 20s are pregnant, you can see the pigmentation already. So besides age, the most important is really your sun exposure, your hormones, and also your genes. Okay? Topical skincare. Yeah, just now when I asked about how to treat, somebody mentioned hydroquinone. So I swear by God that hydroquinone works like a charm. But according to the American Association of Dermatology, what has been agreed true worldwide is only 4% hydroquinone, nothing more than that. Although there are some doctors who I know mix and put a bit more just to have a faster result. So what's wrong with hydroquinone? Why are we very careful even if it's a really, really good bleaching agent? So I think hydroquinone, if you have a pigmentation problem and you use hydroquinone and you use it religiously for every day, every 12 hours, morning and night, You see, the half-life is about 12 hours. So if you are going to start, you have to do a 12-hour strict regime. And if you were to do this for at least 2 weeks, every day, you can already see at least 20% clearing of your pigmentation. So it works so super. I love it. I like it. But you cannot use it more than 6 months. Why? So if anyone remember, you know, in Malaysia, we used to have all these companies who so-called made skincare and so-called to have illegal ingredients, they say like mercury and all this. Actually, it's not really mercury. What they actually put inside the skincare is hydroquinone, sometimes up to 10%. And what happened is when they use too much and people use it without control, you get this other condition in your skin, and it is called ochronosis, which is a bluish discoloration of your skin. Now, what is the biggest problem with ochronosis? If you think that melasma and PIH, post-inflammatory hyperpigmentation, is hard to treat, try treating ochronosis. Oh my God, it is the worst. It does not respond to any topical skincare. It barely responds to laser. Even if you try to do a tattoo removal, you may not get a good clearance. So it is no joke. This is really something that we are really like trying our best to tell people and tell patients, be careful. You can use this product, but you cannot use continuously more than 6 months. Actually, most dermatologists or skin specialists or aesthetics, we normally tell you 3 months, observe. If it's okay, then you continue 3 months and totally stop and switch. So normally what do we switch to? Other bleaching agents. So what are other bleaching agents? We have arbutin, which is actually hydroquinone with an extra sugar bond. But because of this extra sugar bond, it doesn't act too much like hydroquinone. It does give a brightening, lightening effect, although it takes longer, about 6 weeks. A lot more stable than hydroquinone, so you have less risk of getting ochronosis. But still, like I said, it is hydroquinone with extra sugar bond. Okay, and then you have other things like azelaic acid, kojic acid. You can use vitamin C, other types of bleaching agents. Okay. So topical skincare is something that once you use it, if you're talking about brightening, if you start hydroquinone, it is a strict regime. And if you are not willing, better don't start it, okay? The types of topical skincare that we normally give, sometimes you have things like cheaper version of hydroquinone is melasine, which also works. You have another product called Triluma, which is a mix of vitamin A, hydroquinone, and a steroid, which is actually mometasone. But you have to be careful because it can also cause skin sensitivity. And then one of the gold standard for hydroquinone is actually, to me, would be the Obagi range products, which is so expensive, to be honest. Like, even when I had to buy it myself because of my own problem, yeah, I burnt my face just so I did show it to you guys, right? Yeah. So basically, it's a 2,000 plus skincare range to use for 6 weeks, and that's it. Sorry, 6 weeks, 6 months, and that's it. Like, the whole set is 6 months, 2,000 plus, one time off, and then after that you rest. Okay. Okay, let's talk about medication. If anyone heard of tranexamic acid, tranexamic acid falls under the category of NSAIDs, which is a non-steroidal anti-inflammatory drug. So the thing with tranexamic acid, we have found that it also blocks the thyroxinase pathway that causes, it's a pathway that causes melanin to be formed by melanocytes. You have one enzyme called thyroxinase. So when it inhibits, then it doesn't change, so it doesn't form the pigmentation. So this is even more, deeper layer than just using sunblock or bleaching agents on the targeted. It actually stops the complete, it's like, okay, put it this way. It's like you have a factory and you have a production coming in. So tranexamic acid works at the supply before you go into the factory, the supply chain is already stopped, okay? So because there's no supply, there's no output, less pigmentation. But the thing with tranexamic acid, because it's an NSAID, it does cause gastric disturbances. You know, you have like people with acid reflux problem or gastritis or sensitivity to NSAIDs, like you cannot take this, okay? The other thing about tranexamic acid is it's only safe to be taken as a tablet. The IV forms or the IM forms, we use it to stop hemorrhage or blood loss, especially in women who post-delivery. So we use 50 grams and we shoot it up we don't shoot it up, we just inject the thigh to make the blood clot faster so that she doesn't bleed to death. But the problem is nowadays, for whitening purposes, you have whitening IV sets that actually put in tranexamic acid. And yes, I do admit they do look super, super fair, but at the same time, they are risking themselves to getting a stroke because, like I said just now, tranexamic acid is used to stop bleeding. So imagine if you're not bleeding and you inject yourself with tranexamic acid, you may well produce clots in your body and you may well get a stroke, okay? So this is one of the things that I have noticed, that in certain of the Asian whitening regimes, the Korean, the Chinese, they do involve putting tranexamic acid inside the drips. And to be honest, this is just my personal take. I don't agree on it because I don't agree on putting my patients on harm. Normally they use 250 milligrams of tranexamic acid. In post-pregnancy, we use 50 milligrams and that's it, stop. All right, so this is one of the things. So if you want to take it as a tablet, it's a lot safer, but you just have to have a bit more patience. So for melasma treatment, it is accepted to give tranexamic acid tablets 6 weeks. So 6 weeks of tranexamic acid taken 3 times a day is a safe dose. Sometimes they take it 2 times, but you can take as much as 3 times a day. So tranexamic acid is similar to the other one, mefenamic, which we know as Ponston. So actually Ponston also has a similar effect, although tranexamic acid has a much better effect with your pigmentation compared to Ponston, okay? Now we talk about IV treatments. Do they really work? Well, in my years of practice, I have seen this. It does. It really does. But the problem is, yes, how much IV treatment can you accept? Because you have to understand high dose vitamin C, is a water soluble, maybe 3-4 days is out of your system. High dose glutathione, also water soluble, same case. So it does work, but how many sessions do you need? I have seen patients who've done up to even 5, 6, 7, 10 sessions, and they only get like maybe 2 or 3, only 2 tones lighter, which if you stayed indoors like this current MCO, you would have been 2 tones lighter anyway. So yeah, but then the moment they stop doing the injections, like if they don't maintain at least once a week or once every 2 weeks, actually it's more once a week thing for whitening, they start to tan again. So is it really worth it, or are you just like literally wasting your money to make yourself white? Okay, but to be fair, I have seen, I do use IV treatments. IV, I call them my vitamin cocktails. I don't use it for whitening. Whitening is really a side effect of the what do you call it, the drip. But what I really use it for is to help people with hangover issues, jet lag issues, low energy issues, fibromyalgia, plus minus, lethargy issues, or sometimes people who are extremely stressed out pre-exams. Yes, I have done that before, like, but blushing. People thought that he wanted to become a Caucasian because he had all these Caucasian girlfriends, but the real truth is he had vitiligo problem, which is why, and he had it since he was young. So what happened was it started from the mid and it started going to his hands. And if you notice, he was wearing gloves most of the time. It was really, really because of the vitiligo until he bleached his whole body. And then you notice that he doesn't wear any gloves. And that's that, but he becomes extremely, extremely sensitive to the sun. Sunblock. So we have top. Oh my God, I'm talking nonstop. Anyway, okay. So that's IV therapy for you. Now, the thing is, you may think that it's a really cool idea to kill off all your melanocytes and melanin and become super, super fair like powder. It's not, because the thing is, we have melanocytes and melanin to protect us from the sun. When we are exposed to a bit too much sun, the melanocytes produce more melanin as a protective layer to the skin to block off. This is why we turn tan, or that's why when you go to the beach, you come back tan. So getting rid of it is not really the best idea, okay? Now, moving on to sunblock. We have the topical ones, we have the oral ones, we even have a wash nowadays, which is quite interesting. So talk about topical sunblock. How much SPF do we really need in the sunblock? Any takers? Does anyone know what is the SPF level that you need for a good sunblock? Hello?
Is it 50?
Yeah, so what's 50? Okay, anyone else? What is the minimum requirement sunblock that is already considered good enough? Is it 50? Is it 100? Is it 80? Is it 10? 45. Oh, interesting. 35. Where does 5 come from? 50 plus plus plus. Okay. All right. The right answer is actually SPF 30, but 30 in the end product. Why do I say 30 at the end product? It's because when you talk about commercial sunblock, they would write their SPF 30, 50, 60, 80, but that is before mixing. After mixing, they never check. So sometimes when you go and buy a commercial sunblock, it's stated that SPF 50, but in reality, it could be maybe just 35 or maybe 20, because after all the mix, it's actually a different SPF there, okay? So according to the American Dermatology, again, they recommend SPF 30 because based on their calculations, 30% SPF 30 is translate to 93% protection against UV light. If you take SPF 50, it's only 95% protection. So there's only a difference of, 2%. So whether it's 30 or 50, it doesn't matter. But what really matters is the end product, the end SPF, not the pre-SPF. So a lot of cosmeceuticals, especially those, sorry to say the locally made ones, they actually put the SPF as the pre-mix SPF, not the end product SPF. So that's number one. Number two, you also have to understand whether your sunblock or sunscreen, is it a sunblock or sunscreen? So what's the difference is when you talk about sunblock, it normally has oxalate, and what it does is it goes into your skin and the oxalates will act as a barrier and it actually wears out. So for example, in our hot sun and you wear sunblock, within 2 hours, you have to reapply because all the oxalates that's already in your skin has taken up all the UV rays, and then thus, it doesn't work anymore, right? Whereas when you talk about sunscreen, they are chemical and there is also you have a chemical and you have a physical sunscreen. So when you talk about sunscreen, a screen is like a screen. It actually just bounces back the UVA and UVB. So the normally in the market, they use things like titanium oxide or zinc oxide as a screen. But the problem with titanium oxide, a lot of people get irritation when titanium oxide is heated up in the sun. So these are reasons why you cannot use certain sunscreens and sunblock. Now the problem with sunscreens and sunblock is that because sunblocks are a bit better, but sunscreen, you know, when you wash with water, or you say that, oh, I'm using waterproof sunscreen or sunblock, and you go to the sea and you take a shower, you take a bath in the ocean. The problem is the chemicals from this sunblock and sunscreen kills the corals. I was in, like, a month ago in March, just before the movement control order, I went to Sabah, Kota Kinabalu, for a quick change of air. And since I had time, I went island hopping. The main culprit that causes all these corals to die is actually sunblock and sunscreen. And looking at it, I felt so sad, but they have a sign there and tell you not to wear any sunblock or sunscreen into the water. So I didn't. So I got burned, but then still I wanted to save the corals. Give and take. Okay, then we talk about oral sunblock. There are few in the market. Heliocare has one. You see, oral sunblock and whitening supplements are not the same. Oral sunblock has an action to block sun UVA and UVB. Okay, sometimes just UVA, but mostly they block both because of a chemical that when you consume it, it actually acts as a protective layer under your skin. How it really works, nobody really knows, but I have tried a few oral sunblocks like Heliocare. I've tried, what's the other brand? I've tried a few, and I do find that oral sunblock does work to a certain extent, but to a certain extent. In order for it to work, you have to start consuming at least 3 days or 4 days before your beach holiday. And you have to be dose dependent. So if it says 2 times a day, it means every 12 hours. Okay, so that's how it works. And it doesn't make you fairer. It only blocks the sun. So you become fairer because you're not exposed to the sun. But if you have pigmentation, etc., it doesn't help to lighten it up. Or even if it did, it would have taken such a long time. So I did go on a trial of oral sunblock for at least 3 months to see the difference without using a sunblock. Actually, I did a split face. It did help to a certain extent, but it's still better to wear an extra layer. Okay, sunblock wash. Okay, this is something new. It's technology from the US, uses anions. They use ion, positive and negative ions. So the wash actually is like a soap. So you use it in the shower, like your last wash. And let's see what I have it here. 1 second. I think I do. Okay. This is like an example of, this is a medical grade sunblock. Personally, I like this because it's gel and we're in a humid tropical country, so it does help. This is a sunblock wash. And the reason I have this is because I was curious, so I wanted to try. And this gives you a 30 SPF. So the idea of it is that you wash, and until your next shower using any soap, it stays on. So it's okay. I do find that it's okay, but it will not stop you from getting tans. Maybe the only issue I have is that you have to lather, and if you wash your hands with soap, the soap will take off the sunblock because it's negative ion. So what happens is when you wash on and you lather and you leave it and then you shower and wash off with water, you have something like a positive ion sunblock on your skin. So that's that. Does it really work? Does it work or doesn't work? I think to some extent it does. And I guess the best people for this would be, you know, if you have those boyfriends or husbands who have a real big issue of wearing sunblock on their face when they go out running, perhaps this is a good solution, or golfing or anything. Okay. Now you talk about supplementation. You have vitamin C, you have whitening pills like crystal tomato, you have lucerne, and Stella also has a product called Sterilica, which I have not yet tried, unfortunately, but it does the same thing. So how does supplement work? Like basic for vitamin C, if you want it to work for whitening, you have to take it during the day. If you want to help your immune system, you take it at night. And we talk about dosing of about 1 gram a day, 1 or 2 grams a day. But the problem with vitamin C, if you take too much, you will find that one, you get dehydrated. Two, sometimes it comes out in your urine too much. So yeah. Number 2, so that's vitamin C. So, and topical is, to me personally, topical is better than, although it doesn't give a whole body thingy. So whitening pills, like I said, crystal tomato, lucerne, and Sterilica. So what they do is they have found this component called, crystal tomato and lucerne are quite similar. They're from a tomato that has something called lycopene that actually helps with whitening, and it acts as a whitening agent plus sunblock. Sterilica acts as a supplement plus whitening, but no sunblock. Okay, so it's different things. But the problem is when you take any oral supplement, one, it takes time to act. Number 2, you have to continuously take it. Like for example, I did a comparison study between crystal tomato and lucerne. When I took crystal tomato, 800 milligrams, it took me 10 days to actually see 1 tone difference. But during the period that I was taking it, I noticed after 3 days, my skin started to glow. Lucerne, I think about 7 to 8 days, or it could be that my gut was already in tune with all these whitening products, because I tried the crystal tomato first and the lucerne. So these are the 2. But same, I am a sun worshipper. I swear to God, I love the sun. I like being by the sea. It doesn't help to protect you from sunburns. Okay, you still get sunburn if you're not careful. Okay, so that's that on the treatment options. Okay, now when you do treatment for pigmentation, there are a few results that you can see. Like this first picture, to be honest, after studying it, when I took it first, I just wanted to show when you do laser and normally you have to add this with some, some skincare and also sunblock. You can actually get quite a good clearing, but then when you look carefully at the 2 pictures, I think that this is an Adobe picture rather. Not for anything, it's just that, when you take 2 pictures, you can never get 2 people sitting the same. So I feel that it's a edited photo online. Okay, as for the second photo, you can see that in this picture, the top part where it has a pigmentation has lightened, but the bottom part became worse. You see, it's not easy to treat pigmentation. Normally, when I tell patients, let's not do a spot on your face, but let's just do the whole face and focusing more on the spot. Because sometimes what happens is, you're so obsessed with one spot and you treat it with laser, you get rid of it and you start seeing all the other spots. Or the heat from treating that area has induced other parts of the face to produce more pigmentation, right? And for acne scars, also the same. You can even treat this with laser or even just chemical peeling or topical agents. But to be honest, studying the photo, I think this one was photoshopped. Okay, let's go on to the next topic. Prevention and maintenance. Okay, this is something that a lot of doctors don't really explain to patients. Like, fine, I can get rid of your pigmentation. I can reduce your melasma and maybe reduce your PIH or get rid of that spot that you don't like. But the thing that you also have to understand is that, yes, maybe one treatment gets rid of it, but you still have to maintain in order for it not to come back. Like I mentioned before, during the IMCA study, they did melasma treatment, and if they do not do anything to look after the treatment, the post-care, within 3 weeks, the pigmentation came back, and sometimes it comes back with a vengeance, and it's worse than even starting. And this is what you get if you actually look and listen to people talking or read online forums, what happens is they go to a salon and they get laser pigmentation, and after 3 weeks they get worsening pigmentation. Okay, so this is the other thing. Secondly, sometimes the first treatment will make your pigmentation darker, which is why you need more than one treatment to treat pigmentation. There is no such thing as, if you ever go and walk into a clinic and the doctor says, don't worry, I can get rid of this in one session, I swear to God, the guy's lying, number one. Number two, he doesn't know what he's talking about. Number three, he's gonna destroy your face. Number four, he's really going to underpromise. You will need at least 5 to 10 sessions, regardless, whatever laser you're using, to be safe. Why? Because one, even if we remove the pigmentation, we still may cause worsening pigmentation. So the second one will fix it. Or first one is remove, second one, so you get the picture. And it's also the maintenance of it, because you want the melanocytes to be suppressed as much, okay? Or you want to kill off as much pigment as you can. So that's number one, laser toning. It's actually a prevention maintenance program that you can actually do. Now, the cool thing about Stella is they do have like 1 year laser where you can actually do it until you vomit for laser toning. Okay, that's one. Number two, what you really need is a good clinical sunblock. Now, I have been seeing patients for 11 years, and I have always given you the chance. My patients, I always tell them, look, you want a sunblock, or do you want me to prepare sunblock for you, or would you like to use one on your own? And what I've observed is that over the past 11 years, really, they have switched from using the cosmetic counter sunblocks to using a clinical sunblock, because they find that with the treatment that's being done, it's not enough with that cosmetic counter sunblock to help to maintain. You need a really good clinical sunblock that totally blocks off everything and make sure that you do not cause additional damage to your face just walking out in the sun. And they are willing to spend. So and to be honest, a really good clinical sunblock is not cheap. It can range anything from 150 to 300 ringgit, because sometimes I order stuff from overseas based on their performance. So this is the other thing. Number three, skincare. Arbutin, kojic acid, vitamin C. Hydroquinone is only for treatment. The maintenance are these three things, and then you have azelaic acid, and you have other things. So when you talk about skincare, normally I would always ask you to keep one extra, which is an exfoliator, or like your friend mentioned just now, keratolytic skincare, just to remove the, dead cells. The other option is to come into the clinic at least once a month, get a light chemical peel, and that would actually sort out the exfoliation. Number four, you have to always avoid excessive sunlight. So if you are a golfer, or if you are a surfer, or you like skiing, or snowboarding, or all these activities that involve a lot of sun, if you're going to start a laser treatment, stop. If you can't stop, don't do the laser treatment unless you're willing to actually take the extra mile to protect your face. Like, for example, you can always wear those ski masks where you can only see the eyes. That's one. And I have seen Korean and Japanese ladies who play golf who actually wear gloves, full long sleeve. They wear something like a white thing and a big hat. And yes, it looks like a mummy playing golf. But they understand that if they sit in the sun, they will get pigmentation problems. So whether or not they're doing any laser, they are already with that mindset. That's why if you see Asian ladies playing golf, normally they have a big giant hat. Okay. For the Arabs, they wear the purdah. To them it's super, because it's like so-called uniform there. Of course, it's not uniform here. We die of heat and humidity here. The difference between the Middle East and here is really the humidity. Like, we're very extremely humid. So if you wear that, you're gonna die sweating inside. It's hot and humid. At least that it's hot but not humid. Okay, correct hormonal problems. If you're pregnant, Don't do anything until you deliver your baby, okay? Because basically when you talk about medical aesthetics, you do not do things on pregnant women or lactating women. So you have to make sure the hormones are correct. Usually for lactation mothers who are lactating, normally 6 months. And then for women who are entering their golden ages of mid-40s, 50s, where you start going into that perimenopausal symptoms, where you start to have more hormonal issues and you start getting all these darker pigmentations, yes, we can correct that. If you can't sleep at night, maybe we have to supplement some of the hormones, and you will find that it actually helps also with the pigmentation problem. And this last one is regular chemical peeling. So if you're not a fan of laser, you can do chemical peels, whichever is your fancy. So these are the simple prevention and maintenance methods. And the key to successful control of hyperpigmentation is always a combined treatment and maintenance. So no one thing will work. Tranexamic acid skincare safe to use. Okay, if you use tranexamic acid topically, yes, it is safe to use. But whether does it absorb into your skin or not, that is the second question. So sometimes we see people with tranexamic topical, but so far I have not come across any product that actually can go through the skin barrier, because you have to understand our skin is it's lipophilic, it's waterproof, it only likes fat. So tranexamic acid is hydrophilic, it's actually in water, then only it actually forms the acid. Without the water, it doesn't form the acid. So that is the thing that you have to consider. So some people say, oh, I can use tranexamic acid skincare. Even when we are doing tranexamic acid mesotherapy, it has to be under the skin because we know that it does not permeate the skin. Okay, Sharon, I hope that answers your question. Okay, people, any more questions before we, such a long chit chat alone. Anyway, yeah. So I would love if you can ask me as many questions, because sometimes I have not covered what you're wondering about. So any questions, people? So feel free to ask questions. Don't be shy. I mean, yeah, even the cat is smiling. Yeah, I love cats. I've got 4 at the back. Oh shoot, I forgot to feed one of them. Let me sing this now. How to reapply sunblock with makeup on. Okay, that is something quite difficult, okay? But the good news about makeup, right? Makeup also contains some SPF. If you use certain concealers, they have like 25% SPF or something like that. So what I normally do is, in the morning, wash my face, put on serums, let it dry, put my sunblock on, and then I put on my makeup. So you cannot really reapply sunblock with makeup, because if you put it on top of your makeup, it'll sit on your makeup, then you put your makeup in a close space with your skin, and then it's not good for your skin also, right? Okay, so you will actually need to well, reapply back your makeup after the sunblock, right? So so the good news is, if you wear a good sunblock, there is a sunblock that actually has 8 hours action until it lasts that long. They did a clinical study in Thailand by my friend Dr. Rangsima. It was very impressive. I love that sunblock. The only problem is the supplier is an ass, so I have a bit of difficulty in getting it. But you can use it as a base for your makeup. So I normally tell my patients who use makeup, your sunblock acts as a base. If you have powders, like loose powder sunblock, you can use it above your makeup. That's not a problem. But if you don't, then you reapply your makeup. It gives it some SPF. Okay. So how to reapply sunblock with makeup on is, unless your makeup's gone, then it only makes sense. Right? It's a bit weird. The other option is powder form of sunblock. There is actually one powder form sunblock. I didn't mention this now. There's one product from Kiss Mineral Makeup. They actually made this powder form sunblock. So how does it work is that, because it's pure minerals, it actually gives out the SPF about around 25 to 35. So the only problem is that how are you going to apply it? Because you have to apply in layers. You see, if anyone who has learned how to use mineral makeup compared to conventional makeup, it is so not the same. Like when you use conventional makeup, it's what you see is what you get, and you kind of like dab it on and you cover whatever you can cover. So you can, however, if you have your standard makeup, use this powder, sunblock, as a loose powder, and you can cover, and it becomes that reapplication of sunblock if you want. Okay, coming back to the mineral makeup itself actually has sunscreen and sunblock properties because of the minerals inside. It actually blocks UV rays and then stuff. So you need to put it in circular motion around the face, layer by layer by layer by layer. So if you want a much more concealment, you need more layers. If you want less concealment, less layers. So that's that. Okay, so does it work? Yes, but you have to put the layers on. So yeah. So frequent use of BB and DDK, will it cause pigmentation? Hello, hi. Yes, favorite question of BB and DD. To be honest, it depends on what they put in the BB and the DD. And so far, if you have a pure mineral BB and DD, which does not exist because you do need a bit of chemical, but usually they talk about 80% mineral, it may have less side effects. Your BB and your DD can actually act as a sunscreen to sun rays. However, depends on the active ingredient in your BB and your DD, because some people put arbutin, some people put even hydroquinone, and some people put mercury inside the BBs and the DDs to help with the lightening use. So whether yes or no will depend on what's inside the BB and the DD. However, if you are a fan of BBs and DDs, I would tell you simple, just if it's good, if you find that it with any product in the market, be it cosmetics, be it skincare, if you find that it doesn't cause any harm to your skin and you're happy with what you have, then fine, continuously use it. But if you have a problem, for example, you start forming pigmentation and you have to go and do treatment to get rid of it, that's when you have to start reconsidering, because sometimes what happens is when you start treatment for pigmentation, your face becomes more sensitive to things, so sometimes it may react with the BBs and the DDs. Does that answer your question, Hai? Okay, any more questions? Yeah, I got this from my alumni. I'm from UM. We had a ball. Okay, any more questions? Going once, going twice. It's going to rain outside. Yep, I see lightning and I hear thunder. Okay, no? All right, for those who have not started to follow me, you can follow my page on Facebook, Dr Maryati Maharon, that's me. Or you can follow my Instagram at dr.marr. And normally I will have updates on those. Although nowadays in the MCO, I don't post as much because I don't like posting my personal home to people. And if you're interested in asking more, oh, thank you. Where are you based? Oh, I'm based in Stella Clinic, San Vigio. It's on the screen. So you can call up the clinic, or you can even WhatsApp the inquiry if you like to make an appointment after this movement control order is over. Yeah, and I only function by appointment, so please don't suddenly ambush the clinic because I might not be there. Yes, thank you so much for everybody who's watching. I hope I didn't bore you to death with so much explanation. It's a bit weird because normally I taught in classroom or in a seminar room, so I can stop and ask questions mid-riff. But unfortunately, because it's one way, so I feel like I'm talking to myself. Yeah. So if you would like to know more about the treatments for pigmentation, or you want a much more personal consult, you can always contact us. You can talk to the Stella Care line, or you can WhatsApp the inquiry, and we can arrange an appointment. It's always good to get an evaluation, and like I always tell my patients, it's always good to do something rather than nothing, because if you do nothing, nothing's going to change. At least you do something, you may improve a bit or much, you never know, but at least you are doing something, and it's also a positive mindset. So yeah, we're having this virtual clinic again. In case you guys forget, please, I will be doing the body contouring and weight loss and overstretching topics. So stay tuned to our other sessions. I hope you guys enjoyed this one. Thank you so much for those who wrote all the nice thank you notes on the Zoom group chat. It has been fun. I hope you guys enjoyed it. I'm losing my voice. Okay, too much coffee, I think. Yeah, all right. Thank you so much, people. I hope to see you guys again soon. Please invite your other friends to come and join this information session. And yeah, if you have any private questions, you can actually type privately and tell me, Dr. Ma, this is private. don't share it with the whole group. Or you can just contact our just now our inquiry line, and they can get you an appointment, and we can meet up or Skype or whatever during this MCO. You know, during the MCO is a good time for all of you to actually start planning what to do after this control order is over. Like, for example, I have been consulting patients on those who wanted to do cosmetic surgeries or step-by-step facial rejuvenation and this and that. So this would be a good opportunity for you to put a mindset to understand what's the best thing to do for my face or my body or my life at this point in time. Well, anyway, people, it is already 3:40. I hope you enjoyed the session. Thank you so much. So we can, I know it's about 20 minutes to 4, a little bit early, but thank you so much, and hope to see you guys in the next one. Thank you. Oh yes, stay safe, peeps, during MCO. Please don't go walking around. Thank you.